Perhaps the biggest headline of all this weekend is health care. As Congress returns home this weekend, they are getting an earful on the issue. Town hall meetings all over the country are looking more like shouting matches, with some people being sent to the hospital after fights and some representatives receiving death threats.
So what's going on right now, and will there be health care reform in this country? Joining us now is Republican Congressman Brian Bilbray of the 50th District. Congressman, good morning. Thank you so much for being here. Welcome home for a little bit, I guess. Let's get right to it. We've seen the video. We've seen some of the chaos taking place at these town hall meetings. Some Democrats blaming Republicans, saying this is a setup. This is their way to kind of get in there and make sure this bill doesn't get passed. Your opinion on what we're seeing right now?
Look, there's no setup because it's going on back and forth. I think that it's pretty naive to think that somebody is organizing this in some great conspiracy. I can't cheat at my town hall meetings. I think the biggest issue is there's a lot of backlash against this. Let's cram so much so fast. I mean, we crammed the stimulus package, and then we had AIG pay raises that nobody was allowed to. There was the issue of this, what was supposed to be a climate bill that ended up being a huge subsidy for ethanol and coal producers. You see the Sierra Club opposing that. And then all at once this issue that health care has to be changed right now before August break. And people were very concerned that what was happening in Washington was not only that things were being forced, but no one was being allowed to read about it, the public or the people who voted on. So I think there's a lot of this credibility. So people are very upset and very worried about things being forced without anybody being able to participate.
But some of the tactics being used right now, it's been pretty extraordinary anger and outrage, yelling. Do you think the way that people are going about it right now is helpful to an important national debate, or do you think it's kind of drowning out the substance of the issue?
No, I think it's drowning out the substance, but I think the problem is saying we don't have time to talk about it, you don't have time to read it, has made people raise their anxiety and their suspicion that there's a conspiracy out there to force something that the public isn't allowed to know about, but are going to be forced to pay for. So when you think about this, if I told you, you sign the contract, you don't get to read it, wouldn't you be suspicious? And that suspicion, the tactics being taken of saying let's move this so fast that nobody can look at it, raises the suspicion and the paranoia, and then the frustration comes out. And so you really got to understand that process does matter here, and outcome is one thing that people are concerned about. Why aren't we talking about the trillions of dollars of cost? And so people do raise that, and I think those tactics had to go back.
On the substance itself, the big question is, do you think that Americans have a fundamental right to health care?
No, they do not have a constitutional right to health care. This is something that we've got to understand, that rights and responsibilities. But we do have a right to expect our government to be responsible and take a look at these things, to not only promise something, but make sure we can pay for it. And then here's the big thing. We have a constitutional right that our representatives find a way to pay for something before they start promising. And that's a great challenge. I think we all know Medicare, Social Security are a promise, a commitment we've made. We still don't know how to address that. So I think that one of the things that we have a constitutional right and a right to demand, show us how we're going to pay for it, show us how it's going to work out. I mean, some people would say, let me give you an example. If I asked you when we did a poll, would you like to have a free home? I think most people say yes. But if you were asked, do you want to live in public housing? That's a whole different thing. That's the essence here. And just as in public housing, where we once had a system that said government will build one big complex and everybody will live in that, and you saw the problems, we abandoned that model after 60 years, and we went to one that vouchers, and you go now to Section 8 and go to the private sector. The big question here is, if we create a system that's bigger than anything else in the world, got to understand, you know, Canada's only 23 million. We're talking about a $300 million project, and we don't want to have to wait 60 years to correct our healthcare system if we make a mistake.
But wouldn't homeless people want public housing?
Well, the fact is, and they do get it, we have a safety system, and that's always the deal. Those who cannot afford anything, they end up having a system, and that is one of the arguments for saying, what about the middle class? And that's legitimate. The question is here, you don't want to destroy the best way to provide health care, and that is do a good job that gives benefits. And one of the big concerns, and you watch this, is in the bill that looks like it may come up, and we don't know. We got a month now to look at it, but we don't know what's going to come up. we could actually give employers the ability to bail out and dump their existing plans for a plan that is 8% across the board, which is a big savings to a lot of these companies. We may see people being dropped off their insurance because we've ended up creating it. So these are details that we not only need to do, we have a right. If you want to talk about a constitutional right, we have a right to know what our people are voting on before it happens.
And speaking of money, let's get to the local stimulus money that we've seen here in San Diego going to various places. What do you think about where the money's going, and would you like to see it go towards something else?
This is a classic example of why there's so much concern about forcing the health care without people knowing about it. Nobody meant, or I can't believe that Bob Filner or Susan Davis meant to vote for a bill that had AIG pay raises in it. Nobody meant that. Bob admits to it. That meant to have a special project for breast implant clinics. That was not meant to do, and that is why slow down. Just because you think you've got a crisis isn't time to panic and start voting to spend a lot of money. And I'll tell you, when this bill was coming forward, the battle cry was, quick, we got to do something. That's what one lemming says to the other just before they jump off the cliff. And now you're starting to see spending that I don't think is going to be defensible, especially in the next election. So a lot of people are nervous about this.
All right. Well, Congressman, thank you so much. We appreciate your thoughts.
We talk about this all day. Unfortunately, we're out of time. Thank you so much, Congressman. And for more information on how you can contact the Congressman, you can go to our website, san diego6.com, click on Hot Topics.